You ready? Just tell me when. Hey, good afternoon. This is Mike Petronas at Springhill Medical Center. I'm joined today in person with nurse practitioner Clay Strange and nurse Tiffany Petrie. Also, Derek Melancon's in the background taking care of all of our logistics and getting us on video. First of all, I just wanted to say, please, if you'll put us on mute, not on hold, please place us on mute. And then in a little while, after we go through a few things, we'll do some question and answer and give you a chance to ask questions. For those that are logged into Facebook Live, you can ask questions. Derek's going to be tabulating that as we go through. So if you're thinking of something now, or you think of something as we're talking, please feel free to pop in questions even right now. So listen, we've got several things that we're going to have online for you today. Dr. and Clay are going to go into a Q&A with Tiffany here in a little bit. And in just a few minutes, you'll also get to hear from Chief Will Lynn from the police department, as well as our fire chief, Michael Morris, as well as Jessica Truchell. I hope I'm getting that name right, Jessica. She'll be calling in from our Pafford Ambulance Service as a paramedic. But first, I just wanted to have some general comments. Thank you. Thank you so much. We've had such an outpouring of support for our medics, as well as first responders in the community. Mayor Ray Huddleston has articulated to me, as well as others, just how much of an outpouring of support that's been coming in, as well as we've had a little bit of food and some scenery on our sidewalks and around our facilities of the love that you guys are showing of your medics, and we certainly do appreciate that. I'm going to lead in with that's what we need right now. We've got a lot of things in the news that you're seeing that with Dr. Fauci and President Trump, the numbers that they showed this week are a bit staggering, but as you start tracking and looking at the number of cases and the number of deaths in the country, starting to show the results of having the virus out now for several weeks, we've been very fortunate to this point. As we've come into today, over the last 2 weeks, locally in our parish, we've had very few cases from a perspective of those that are being tracked. But we have definitely had a showing that the virus exists, and out of our facilities, Springhill Medical Center and our clinics, we've had, I'm looking at our board in our Emergency Operations Center here, 125 tests, 51 results are negative, and 4 positives. 3 of those positives were from clinic visits in Butler-Absher Clinic, folks that went to Butler-Absher Clinic and were tested there, and 1 out of our Homer Clinic that was tested there. I do want you to keep our sister hospital at Homer and the local community there in your thoughts and prayers. They've had a little bit more activity, and so they're working with that as we speak. Our current challenges here are really going to be more depending on the volume of cases that we have. We've been working through surge ops planning, as well as our clinic transitions to telehealth, and our biggest challenge will be here, some of the medicines. And it's not just the ventilator, but the actual supply that goes with that. But our folks have worked feverishly to get supplies in, so we have had some supplies, and we've got enough to begin our surge ops, but to be able to sustain that, we will need our supply chain to be able to deliver on time. We're also coordinated well with Willis-Knighton and other facilities in Bossier-Shreveport, so as we do get patients here, and we handle a certain amount of workload here at the hospital, we can quickly transition and transfer folks over to Bossier-Shreveport as needed. I would want to, before I turn it over and start having some of our first responders, firefighters, and our defenders talking to us, and then going into our question and answer. I would want to remind everyone, please take this seriously. What you're seeing in the news is real. We do have, we are seeing this, and as we're talking every day in our group of hospitals, this is real. So if you're listening out there and you kind of feel like, well, we're kind of remote, we're in a rural area, we don't have to worry about things, we're not shielded. It is here. It just, depending on how much and how severe our patients are, will we see a severe outbreak here. I'm just hoping that everybody's doing their job. Stay home. If you don't have to be out, please stay home. Wash your hands. Do those things that you're supposed to do. If you're exposed to a COVID positive patient or someone who's confirmed positive, please do your duty and stay home for 14 days. If you're feeling bad, we're trying to reach out to you. Our clinics are open. We have transitioned to telehealth. We did that within 5 days. Clay's going to talk to you about that. Tiffany's going to talk to you about that, and Dr. Asher is going to talk to you about that. But if we can keep you from coming in, that reduces foot traffic across the community. And if we can do that through telehealth, we want to do that. But if you need to be seen, we're going to see you. If you need to come into the hospital, we're going to hopefully talk to you before you have to come to the emergency room. So we're ahead of this as much as possible. So so please work with us on that and just communicate with us as much as you can. All right. With that, I'm going to see if Chief Lind, are you on the line?
I'm here, Mike.
Okay, sir. You have the floor.
On the police department side of it, and we're very fortunate, like you said, and just to reiterate a little bit, Mike, that, you know, we haven't had any cases in our Springhill area yet. They've all been in the Homer Haynesville area. And it doesn't take one person, and we all know somebody that lives in that Homer Haynesville Claiborne Parish area. If you went and visited them, you picked it up, you brought it back, it takes one person to infect an entire community. So don't think, well, just one has it, that's not a big deal. It'll just spread. As far as the law enforcement side, we still have our curfews in effect for 9 o'clock at night for juveniles till 5 o'clock in the morning. They're not supposed to be out or on the streets unless they're going to work or to the hospital or some type of emergency. The same type of law is in effect for adults beginning at 10 o'clock at night and until 5 o'clock in the morning, unless they're going to work or to the hospital or any other type of reasonable emergency. Today, I've heard a lot of outpouring and pleas from trying to limit our traffic in stores. I implemented an order that will fall under 14329.6 is the law. 14329.7 are the penalties of that law. All stores that are essential and are still open can have no more than 10 people in their store. That includes convenience stores. There are 6 exceptions to that law. Those exceptions would be Walmart, Piggly Wiggly, Brookshire's, Tractor Supply, Dollar Tree, and Dollar General. Tractor Supply, Dollar Tree, and Dollar General can have 15 people in their store. Walmart, Brookshire's, and Piggly Wiggly can have 25 people in their store. Only one member of a family. So if me and my wife and son and daughter go to Walmart, we walk up to the door, they're going to say one of you can go in and shop, the others have to wait in the car. That one is to limit the exposure. 2 is to allow more families into the store to get what they need and get back out and try to keep the access going for you to get your essential needs. I know it's a hassle. I know it's an inconvenience. It's a hassle and an inconvenience for the police department and the fire department and the ambulance, the hospital. We're all on high alert. We plan for the worst. We hope for the best in all situations. And once again, there may be some other stipulations that I have to put out in the future. Like I said a few meetings ago, this thing is evolving. Nothing is hard. Nothing is constant. It's ever changing, and we're having to change with it and do what we do best or what we think is best to protect the public. I mean, we're not trying to infringe on anybody's God-given liberties or anything that the Constitution gave you. We're just trying to protect you during this crisis. If there's any questions, Mike, you have any questions for me, I'll stay on the line and take questions from the public at the end whenever we get done. I've been clear on everything. I'll make sure I have.
Yeah, Chief, thank you very much. And by the way, just please continue to extend out to your men and women how much we appreciate them being out there every day in the middle of this and taking care of us. But Derek, let me stop. Did we got any questions online for Chief Lynn?
Not yet.
Okay.
Mike, this is Springhill Mayor Ray Oates. Can you hear me?
Yes, sir.
Okay. I just wanted to say that the chief and I talked earlier today, and we both came to this decision. But I definitely support him on this because we are having a large number of people congregate at these stores. I mean, I've seen them today. I went out and looked. And I know it's the first of the month that people are out, but we just got to go by what he said earlier. I mean, we just got to save lives, you know. Mayor, I appreciate that. That wasn't just my decision; it was mine and your decision, along with the city council full support. That won't go into effect until tomorrow morning. Also, something I did leave out that we need to mention is all city parks are closed. We're getting in the morning. There'll be some signs up and some caution tape around the toys in the areas. I know you may be the only one in the park, but you don't know who came in and touched that before you got there. So we're going to shut down all those facilities as well. That's a good idea. Yeah.
I think you make a real good point too, Chief, and that's something that even as medics we've been talking about internally. How many times could somebody touch something somewhere along the line, whether it's in our building or outside of our building, and folks that are coming in and out, vendors and that sort of thing. So good time for me to remind everyone to whether you're at a work center or you're at Walmart or an establishment or at home. Wiping things down, doing extra cleaning, especially if you have a member of your household that maybe seems a little out of sorts. You know, this virus has a lot of different ways of manifesting itself. You may not have a fever, some of these other things like you're seeing on TV, but it doesn't hurt to wipe things down on a regular basis and get in a little higher level of cleaning mode. Even your car, especially if you've had a few passengers in there, wiping your car seats down, steering wheel down, all those places where you touch and you're not used to. Chief Halls?
And Mike, that's all great points. And like I said, it just takes one person to infect the entire community. And we're going to get through this. This isn't doom and gloom. Keep a bright spot, do what you're supposed to do, and we will all get through this eventually. And a whole lot quicker if everybody would do what's asked of them.
Maybe a couple of sprinkles coming in a little bit later on this evening, but most will stay dry. Those temperatures will fall.
Thank you, Chief. I had someone just dial in that has their. We're getting feedback. Can you put your mute button on? If we can get a mute button on, thank you very much. Okay, fantastic. Before I let Chief off the line here, many may have just gotten the emergency alert. It looks like Governor Edwards has extended the Louisiana COVID-19 stay-at-home order until April 30th. I'm sure most folks have that, but that did just come out on text about 10 minutes ago. Any questions for Chief Lynn?
I got one right here. Does the 25 number count the employees and the shoppers, or just 25 shoppers?
Could you hear that, Chief Lynn?
Just 25 shoppers. We're not limited to the employees or the 15. All those numbers, the 10, the 15, and the 25, all has to do with the number of customers. It has nothing to do with the number of employees.
Okay, thank you. Anyone?
Hey, would you repeat that again about the number that's allowed in the stores again?
At most stores, like your convenience stores, with the exception of 5, it's 10. Those 5 exceptions are Walmart, Piggly Wiggly, Brookshire's, Tractor Supply, 6, Tractor Supply, Dollar General, and Dollar Tree. Tractor Supply and the Dollar team, the Walmart 5 household member can enter into the store. You can't take your entire family into the store. Just it needs to be one designated person to go in and get what the family needs and leave back out of the store.
I have another question. Maybe it's to the Springhill Medical. What's his name? Mike.
Yes,
You're
ma'am.
talking about masks. Do you think it's, because I go in the store, I have my mask on because I have a couple of them myself. And what do you think about the mask? Do you think people need, because that's one of the questions today about masking up, whether it's safe or unsafe.
No, it's a good question and a fair question. I'm glad you asked it. So from a general perspective, just let's say that you have in your garage, you might have an N95 mask that you bought from Lowe's, or you might have a surgical mask, or you might just have a piece of cloth. Those are various levels of protection for you and various levels of protection for the other people that you're around. And so if you are just protecting you from others, a surgical mask would do that. Just think of it like this. If I sneezed, if I coughed, if I had any aerosol coming from my nose or my mouth, a surgical mask would protect you from giving that to others, which is not a bad thing because we really don't know who has this virus because we're not testing everyone yet. So from that perspective, you're doing a good thing. If you don't have a surgical mask and you just had a cloth, a bandana, something like that, that would certainly prevent large droplets from coming from you. But to protect you from others and aerosol that might be in the air if someone sneezed or if someone coughed and you were standing in line, then having an N95 mask would protect you more in that scenario. So I think it's a great idea. In fact, I would say that if you have gloves, wearing some latex-free, if you're allergic to latex or latex gloves, would help as well. Because when you think about it, you go onto say a shelf at the grocery store and someone's grabbed that cereal box and put it back. If that's that one time that someone had sneezed in their hand or something like that, I'm not trying to scare anybody. But this is the reality that we're living in right now. Just yesterday, Tiffany was telling me that she actually takes her cereal bags out of her box, throws the box away, and the bag is what she brings into her cupboard. And I just think that's just being smart. And so that's a good question. I'm glad you asked it.
Mike, can I expand on that just a minute on the law enforcement side?
Yes, sir.
Because and I agree with everything you said. The masks are great. And everybody should wear them as much as they can. I have had to field a few questions during the winter. There are certain gas stations that if you go in to wear a mask, they're going to ask you to remove that mask. That's company policy, and probably is in their insurance policy as well, that they won't allow anybody with a hoodie and or a mask on, because in a convenience store setting, they never know when they're just going to get robbed, and they need to be able to identify as to who comes in. So if you pay at the pump and you're just getting gasoline, you shouldn't have a problem wearing a mask and or gloves. But if you try to enter into that store, there's a good chance that employee or our manager is going to ask you to remove your mask. They're not picking on you. They're not isolating you. They're doing what their company policy says or their insurance and trying to protect their employees during that time frame.
And I'll throw a little bit of medic spin back on that. Miss Paula Duck, our quality manager, says it all the time. Spread kindness, not coronavirus. And so, that's just when you walk in, make sure somebody sees your big smile. There's nothing wrong with that. And thank Will for that clarification, because that's real important. And I'd share with you just any establishment, maybe that just as you walk in, just make sure a nice greeting, let people know who you are as you walk in. I think that'd be good practice. There's got another question online.
Question for Will, and of course, if we get to the store and there's already 25 people in the store, how will we know when it's our time to go in?
each store is going to be responsible for keeping the number of people. They'll probably put counters at the door that count the number of people in, so when one leaves, somebody else can enter. If you're having to wait outside, don't huddle up with 15 people. Split distance from each one, and the store will let you know when you can enter in.
Okay, any other questions out in telephone land for Chief Lynn? Okay, Chief, stay safe. Appreciate you guys. I'm gonna move on to Fire Chief Michael Morris. Michael, are you online with us?
Yes, sir, I am.
Hey, welcome, and we just appreciate you guys. Can't say enough with you guys being out there like Chief Lynn's folks. We just can't express our gratitude enough for you and your team. So the floor is yours.
How are y'all doing? Mike Morris, Springhill Fire Department. Basically, y'all know we run fire and EMS as well for both of them. We've come across, not necessarily in this area, but I know that my full-time job over Freeport, we've had to deal with a lot more of this corona stuff than necessarily over here. But over here, basically what we're doing to try to help prevent stuff is my guys, if it comes in as any type of possibility that it sounds like a possible corona type encounter, then they wear Tyvek suits, safety glasses, and N95 masks. And what they do is they try to see if 911 can get the caller to get the patient to walk out, to meet him outside and sit on the front porch if they're able to move out there where they're in a more open area. And before we ever approach the patient, while they're wearing their gear, they're asking questions like, have you been out of this area, this immediate area in the past, 14 days to a month? Have you been in contact with anybody that's under suspicion or has been tested for the coronavirus? Have you been around anybody that's been confirmed to have it? And then, of course, ask them, have they been running fever, respiratory issues, coughing? We're finding a lot more, and not necessarily over here in this area, but I know Freeport where I work, we found a lot more that a lot of these patients are starting to have colon problems as far as gastrointestinal problems and abdominal pain type problems, and they're popping positive for COVID-19. Mm-hmm. And so it's just, we're still learning all these new signs and symptoms that they could be having along with this virus. And so it's just basically, it's an everyday changing game as far as what the CDC comes up with and lets us in on. So, but that's basically all I got on my part.
Appreciate that, Chief Morris. Let's open it up for questions. Does anybody have any questions of the Fire Chief?
I have a question. This is Nicole. My question is, like people burning, barrels, they burn grass. That's not the right thing to do, is it? Is that the right thing during the time of the coronavirus?
No, ma'am. Inside the city limits of Springhill, it's illegal to burn 365 days a year. But however, due to the coronavirus, state fire marshal has also stepped in and put a burn ban over the entire state.
That's what I thought. Okay.
Yes, ma'am.
Thank you.
You're welcome.
Any other questions for Fire Chief?
Somebody said, I thank you, Fire Chief. You, Chief Will Lynn, great job. I also thank Springhill Medical Center for cooperation and all local officials. I am at your disposal for any help. That's Rudger Dreschler.
We appreciate that. We appreciate all positive messages and any support, be it moral support or other kind of support. We're in here for the marathon and the long haul, by the way. This isn't going to be a sprint. That's not the way we look at it. So So the support from the community is going to be a big deal for anybody that's on the first response side. Chief, we really appreciate you being here. One of the lessons learned that we've had as we have patients coming to our facilities is that we also know at this point we've had a lot of people who've actually tested positive for COVID-19, and so when we have someone, we've added to our questions that we do ask as we have folks in process to any of our facilities, and that is, have you been tested for COVID-19, or do you live with someone who's been tested for COVID-19? So would share that with you. And thank you for being online with us, Chief. And if you need anything, don't hesitate to ask.
Yes, sir.
Next up, from Pafford Ambulance Service, paramedic Jessica. I am butchering your last name, I'm sure. Is it Trutchell?
It's Trishelle.
Trishelle. Trishelle. Okay, I apologize. Jessica, so good to have you on the line. You guys being first on scene, a lot of times you don't get the time to know much about what's going on. So I'm really excited to hear from you firsthand what your thoughts are and what you need from the community to help you guys as you're approaching the scene. So welcome.
Thank you. So I'm Deputy Tracy. I've been a paramedic with Packard for 12 years. I'm also the operations manager. Just some updates with us, our battle on the COVID-19 pandemic. We started preparing for this weeks ago for our patients, our staff, our colleagues, and our healthcare providers. We established a EOC that's located in Hope, Arkansas. It's a unified command that covers all 5 states and the U.S. Virgin Islands. The EOC is screening all possible COVID-19 calls. Our guys on the ground receive this information via text and our 700 radio channel. We are focusing on our employee health, make sure all our guys are healthy and response ready to take care of the needs in our community. We have secured PPE for all our medics and EMTs, and we'll continue to look high and low for them. As most of you know, PPE is hard to come by. We've also educated all of our guys and girls on this virus as far as the difficult ventilator transfers, signs and symptoms. We also are screening every employee upon arrival at work. They're logging temperatures, making sure they don't have any signs and symptoms. They're emailing that to our EOC, and they're keeping track. We're also keeping a close eye on all the updates from the CDC, Louisiana Department of Health, the MS Bureau. As everybody knows, they're changing pretty regular. As everybody knows, we have some of the best first responders in our community. They're going to take all the precautions necessary to continue to provide the best patient care during this time. I appreciate the opportunity to talk. Do y'all have any questions?
Anybody have any questions of your paramedics, your ambulance services? Well, Jessica, we appreciate as you guys come rolling into the ED and we have our exchanges, just get to see how hard you guys work, how much you care about our community, and how much you care for each and every patient. Obviously, when you guys get called out, the majority of the time it's real for that family and that member. And so even without this virus, we just appreciate what you do.
Yes, sir. Thank you very much.
Okay, thank you for joining us today. Okay, next we're going to go into a discussion. For those who weren't with us last week, Tiffany Petrie is a nurse manager over at Doctor's Clinic. She's filling, actually, I'd say an extra bonus role through all of this process. She's the one that has helped transition us from normal clinic ops into being able to have telemedicine, and she and the team have set up those tents that you see out in front of Doctor's Clinic so that we can do drive-through medicine and have a little bit of shelter from the elements and just smoothing out those processes so that you don't have to get out of your car if you don't have to. And I'm just real excited to have with us Tiffany. I'm going to turn it over to you to host a discussion with Clay. And Dr. Absher, do we have you on the line?
I'm here, Mark.
Okay, fantastic. Well, I'm going to turn it over to Tiffany here, but if you or Clay have introductory comments that you want to make, then that'll be fine too. But I'm going to turn it over to Tiffany here first.
Thank you, Mike. Hey, Dr. Absher, how are you?
Fine, Tiffany, how you doing, baby?
Doing fine. How are you, Clay?
I'm good.
Good. Thank y'all for coming. Just a rundown on the televisit process. I know this is new and ever changing every day. But the goal of it is to decrease the foot traffic into the clinics, to keep those who are not sick healthy, to prevent the spread of the virus of those that may be carrying it unknown. On the screen, you will see the app. The Hilo app is what it is, and that is related to our facility as well as other facilities. This is what you would download, and there's a detailed step-by-step instructions that you go through to be able to do the televisits. We do have the call center now at the clinic, the doctor's clinic, that's able to instruct you on the phone and help you download and get your login and your password established, so this will be easy for you. As technology evolves, we've already gotten new processes that we will be looking into to make this easier. I understand with the population that this is sometimes confusing, and especially when you're on the phone trying to do it. So we'll be daily looking at that and coming up with ways that'll make this easier for the community and the public to be able to do. But in a nutshell, this has been very successful. You're able to stay at home or in your car and talk to a provider. They're able to see you and able to ask you questions and screen you, and then as well as order medications, injections, lab, or radiology, and you come up to the clinic and get those drawn as well. Clay, have you seen anything effective in your practice using these televisits, or any decline, or?
Our visits have probably maintained about the same. There's a little bit of a decline in visit numbers, but as the week, last week and this week has progressed, we're seeing more and more patients over the tele app, both in telephone call visits and in virtual visits. And it's a pretty easy process. And we have plenty of people at the clinics and at the call center that if a patient needs to see one of the providers and is having problems with the apps, then they can call in, and those ladies can step by step through the process.
Okay. Ideally, the providers would like to listen and feel, to have the personal one-on-one interaction with the patient, but times like these call for this. Dr. Absher, y'all are doing the telephone visits, correct?
Yes, Tiffany, we are doing the telephone visits. We will be prepared on Monday at the latest to start our audio-visual visits, or virtual visits, if you will. We made great progress today with the help of Dana and Tom and Jane to go forward with that. So we're advancing. We're coming along.
We are. We're in this together, and we're learning every day, and it changes every day. So it's a process that we're trying to all accomplish together for sure. Elephant in the room, COVID-19 seems to be a hot topic. As far as your clinic, Clay, what are some things that you're seeing or patients are calling to ask questions about, their symptoms?
Patients have been calling, and we've been doing the telemed visits for fever, cough, increase in shortness of breath, gastric symptoms as far as nausea, vomiting. Those patients, if they meet the screening criteria from the North Webster Clinic, we've been sending them up to the COVID testing center, and then there have a team of staff members that goes out to the vehicle and is able to screen those patients. And we also have the capability of doing chest x-rays and other lab studies there as we need to.
Okay.
To limit the exposure to our staff. With the
Got a couple of folks, got someone with their phone on. Could you put that on mute for us, please?
With the televisits, I will encourage the patients that when you call in to visit with the providers, make sure you're in a quiet environment. It's a joy for me to hear your kids laughing in the background, or the dogs barking, or to see your dog jump up in your lap. That doesn't bother me, but I enjoy seeing that aspect of you in your home setting. And that's comforting. I mean, that brightens our day. But make it as quiet an environment as you can. Turn the TV off. Make sure your phone's on silent. Those small things that lets us focus on you as the patient.
Okay. Dr. Absher, do you have anything to add as far as signs and symptoms of patients that you're seeing in the ED or that's coming into your clinic that you can talk about?
Yeah, I could probably, as most of you know me, probably talk too long on that subject, but first I would tell you that I'm sitting here in Homer Hospital, Clay Memorial Medical Center. I'm sitting here, I came a little early to get some stats, and I can go over those later if you like. But here's what I've learned in the last 3 weeks. I've had several patients who are positive. I lost a patient 2 days ago, the second death in this parish was a patient of mine. And basically what I've learned is that fever, and this has been public, I thought this was just my experience, but fever is a presenting symptom in less than 50% of COVID patients, and cough is even less than that. It's like 37%. So when you're looking for a patient with a cough, you know, 1 out of 2, basically, you're going to miss it. And I don't know who my audience is here. I don't know if we have a lot of lay people or whoever, but this is my approach since last Saturday or Friday when my patient was admitted, who's now expired, is that every patient I see is that I think of them as either being a PUI, a patient under investigation, or will be someone who maybe actually have overt signs of COVID-19, where they do have 101 fever and they are coughing their heads off and their eyes are red and they come have a sore throat and all that. Well, that's straightforward. But at the end of the day, I do not hang my stethoscope where I'm looking for specific signs and symptoms. Every patient I see, I'll be in this emergency room for 12 hours tonight. Every patient, every room I walk into, if they don't have an obvious laceration, bleeding on their arm, or chest pain with an MI, absent that, every patient's going to be suspect for COVID-19 to me. And our staff, our ER staff, our clinic staff, are all moving in that direction. I don't know how it's going over there, Tiffany, or whether y'all verbalize that or not, but that's kind of where we are.
Right, it is. We pretty much have adopted the idea that if we don't know that you don't have it, we're assuming that you do, including each other, and that's why we take the precautions to wear the mask and treat each patient like they're not sick, so we can change our PPE if needed, and if we interact with them, that's definitely one of the steps we take, is to make sure we've got the appropriate gear on or provide it for the patients. And to be knowledgeable of the ones that have tested positive is a good thing, so we can be more knowledgeable of it. This is something that everybody's learning every day. It seems like you just said it started out being classic symptoms we were looking for, and now we can't base it on that. The fact that you have seen it, we look to you guys to advise us on the changes that you've noticed, and the treatment isn't going to change unless there's other repercussions from it, but the main thing is just to stay at home, stay away, the general guidelines that were given by the CDC and our law enforcement and government. That's the best and only way to prevent. Clay, what is one of the main things that you feel like is important for your patients to know in order to prevent exposure, prevent exposing?
Following the request to stay at home and to limit groups. I think the measures that were taken by Chief Lynn today and the mayor of Springhill to limit the number of people inside of of our stores as a good step. There seemed to have been some confusion there where people would, they were shopping in groups as if there was not a pandemic going on. And I think those measures, limiting the number of people in those stores and limiting those shopping outings to one person from each family group, I think that's a good step in the right direction. We have encouraged all of our patients hand washing, wearing the mask anytime you're not inside your home and out in public, and just stay home. That's the whole importance of the telemedicine visits, was to keep our patients in their homes and yet us still be able to take care of their healthcare needs.
With this pandemic, and Dr. Absher, you for one can vouch for this because the first positive was in your area, but the testing has already changed. The changes with that, the time frame that it's taking us to get the results back. Initially, we were, as we spoke, said that we were looking for the classic symptoms, and it was taking up almost to 12 days, if not longer, to get results back, which is complicated, especially for the provider to try to evaluate and tell the patient what to look for, and for the patient to stay at home that amount of time without knowing the result. Is there anything, Dr. Absher, that you would like to tell the community as far as if they think they're sick, the instructions on what they should do initially, your best advice to give them without the panic?
Yeah, I would, if I could, I would like to share this with the listeners. I would like to share, I just pulled up the patient list since I've been sitting here. We right now have 13 patients in the hospital. Of those, 2 are in ICU with COVID-19. 1 is on a ventilator, okay? Mm-hmm. We have 3 PUI, or patient under investigation. We have 3 more confirmed that are on a droplet isolation unit. And then we have 4 negatives over the last few days. So, as you can see, we've taken care of some sick people. We've learned a lot, and we are always willing to share with our colleagues, of course. Now, as far as the patients that are having symptoms, this afternoon, I'll just give you a little case summary. Is I have a patient who has chronic bronchitis. She coughs every day of her life. She has sputum every day of her life. She has low-grade fever 2 out of 3 days of her life. And she called the clinic this afternoon with exactly those symptoms. Well, 3 weeks ago, I was just, walking through the front door. Today, we had her, we have the benefit of having a separate building in Haynesville. So we have them, we had her go down to the clinic next door, put on a mask and gloves before she got out of the car, and then I went down there and examined her, tested her, and whatnot. That's the exception. The more average, or the more common, is that we have patients calling the clinic and their fever is like just 100.2, 100.6 or whatever. Well, they coughed last night, but they're not coughing today. They had a sore throat. Yesterday is a little worse today. The best advice I can give, and I kind of spin this off of what you, Tiffany, what the mayor was talking about earlier, is call before you come. Call before you come. Call the provider's office, call the resource center, call whoever. But I would not jump in a vehicle and drive to the clinic or the hospital, because there you will be screened also. There's no doubt. But if you call, then you might be able to save yourself a trip, and you might be able to save yourself exposure. And if you are perhaps COVID-19 positive, then they will be awaiting you, just like my patient this afternoon, where we had a nurse who was in her PPE. Patient drugged up, gloves, mask, brought into the clinic by herself, a single room, examined her. I put my PPE on and left, and then she left. And so we've all said it, and I don't know what's hard to understand about this, but the thing with this is to break the chain. We have to break the chain of exposure. We have to break the chain of contact. Ray Holston said it, Mike said it, you said it, Tiffany. We've all been saying it. I happen to be on medical business in Minden yesterday afternoon, and I just happened to stop there and I looked in the parking lot. And I think I had a hard time finding a place to park. And I'm thinking to myself, where these people come from and why are they here? It just doesn't make sense. So I would tell someone, stay home, call before you leave. If you're really having some really serious symptoms, call real quick. So that's where I am.
Okay, thank you, Dr. Absher. I know ideally we would like to test everyone who was even questionable, including ourselves, the staff that works directly with these patients or potential patients. At this time, due to the shortage of the testing reagents and the fact that the different companies are coming out with bigger, better, and quicker ways to get the results, we're unable to do that, but hopefully we will be able to before this is all over. We've already evolved with getting tests back in half the time, if not quicker, so that's a big improvement. But for the patients and the community to know to just wash your hands, limit your exposure to other people, keep the distance, like Dr. Absher and Clay have said, call the office, tell your symptoms, even if it's just reassurance from a nurse or from your provider. We'll gladly do that. We're in this together, and we have to pull through as a community. Being aware and knowledgeable of things that we need to look for and to do to prevent this is the way that we're going to overcome it. I don't know if there are any other questions, Mike, that for Clay or Dr. Absher. Derek, are there any?
No questions.
Okay.
Well, let's turn it over to the telephone land out there. Are there any questions directly that you'd like to ask of Dr. Abshire or Clay Strange? Anybody out there on the phone have a question? Okay, good. Well, listen, and we're coming up on the hour pretty close, and so I am going to say, Dr. Abshire, just from the Homer community, I know we talk every day back and forth, and I get questions over here continually from the community that ask us, hey, are we seeing an uptick? Are we seeing a lot here? And what the state was presenting earlier today was that in Webster Parish we have 19 cases and two have passed. In Claiborne Parish we have 11 cases and 2 have passed. And I think that this is, these are the official numbers where people live, not necessarily whether they're in our system, our health system or not, or in our hospital. So those numbers are not always what we feel like is the up-to-date. But just from a perspective of the community over there and that sort of thing, do you want to just share with folks what you feel like you're seeing as far as exposure?
Yeah, I'll update that. Today, as of today, this morning, we had 15 confirmed cases and 2 deaths. You were on with 2 deaths, okay? What I'm seeing, like in clinic today and Tuesday, is I'm getting more calls. My nurse is getting more calls, and I just have a sense that we're gonna progress a little bit. I'm not saying we're gonna have a surge. That's not what I'm saying. I just think we're gonna see a few more as the days go by. I hope that it's a very gentle slope, if you will, upwards. And the other thing is, Mike, is that we still have, and I'll leave the lab, I'll leave it unnamed, but we still have cases that are 13 days old, meaning patients under investigation that are still pending their COVID results. And so we have a few in 13 days, more 12, more 11 days, more 10 days. So what happened 3 days ago there's a large number to be tested, a lot of tests pending, and those will start coming in, and it will seem like, oh my goodness, we have this huge surge or mini surge, when actually we're getting reports by patients that have already entered into the health system. Right now, I think Dr. Lee Jones earlier today, our infectious disease, we have right now at Homa Hospital 27 COVID tests outstanding. And I would bet there's going to be some positives in those 27. No, there's no doubt about it. So as days go by, you'll hear more positives. Some of that may be actual, or certainly will be actual cases may be increasing, but a lot of that will be, if you would, the backlog that we've been waiting on. And when they're all dumped at one time, it seems like there's a huge spike, where in reality, a lot of those folks are probably over it by now. Thank you.
Yeah, thank you, Dr. Abshire. And just to just expand on lab tests, this probably isn't a concern for a lot of people on the line, because if you haven't been tested, this isn't something that you've been monitoring. But if you know somebody that has and has been frustrated with it, just let them know that we in the health system, and I'm talking about everybody, not just Springhill, not just Homer, but Minden, even Shreveport-Bossier, we've all been very, very disappointed in our ability to get lab tests back. LabCorp, I know they had all the intentions of the world to be able to respond across the nation, and they had anticipated being at 7 days as a start, and then get it down to 3-4 days. Well, that turned into actually 13 or 14 days. And so until last Thursday, Friday, Saturday, Sunday, Monday, Tuesday, we have 2 lab processes that have come to us that have allowed us, and I'll say 3 lab processes: Willis Knighton, LSU Ochsner, or LSU Health, and PLS, that have come available to allow us to speed up the testing. And as of today, one of those processes for those tests in our system that are still outstanding, we've asked Brandy Litton, if you'll please put us on mute. We've got somebody that's, I can hear you on the phone. If you'll put us on mute, please, thank you. If you guys could put us on mute, that'd be great. But anyway, for those couple of dozen labs that we may have been outstanding for several days now, Brandy's reached out to each one of the clinics with those tests to see if we need to rerun them. So we're at a point where we have an ability to potentially do that. So we're trying to do that today and tomorrow and get those resulted so that folks can go on with their lives. And so I apologize on behalf of the healthcare process for not having some of those sooner, but we're in good shape now. We've got some local resources where we're turning things in hours versus weeks, and so it's good news. I'm going to turn it over to just general questions, Q&A. If anybody has a question for the group, I know we're approaching the hour here, and we'll wrap up in just a little bit, but want to see if we have any questions out there in telephone land. Any questions?
Mike, this is Wayne McMahon. Can you hear me?
Yes, sir. Hey, great to have you on the line, Wayne. Good to hear your voice.
Well, I don't really have a question. I just want to say thank you to you guys and Dr. Sam over in Claiborne. I appreciate what y'all are doing over there, and for all our healthcare team and at Springhill Medical Center and on down to the city. I think it's been a great response. There's hurdles that come along every day that y'all are working your way through. I just want to say thank you for doing what you're doing, and I'd like to tell the people out there to please obey the shelter-in demands that we have on us now. The things that we ought to put in place today for the stores. What we're doing when we're out and not taking care of business and not practicing social distancing, and in 2 big groups, we're putting our healthcare workers in harm's way when we have to go see them, and no telling who else we're chancing exposing. So we can't be too safe out. And the better we do now, the quicker we'll be able to move past this virus and put it behind us. So I just encourage everyone to pay attention to what they're doing and be cautious. And I just want to say a big thank you to our healthcare team here in North Webster and in Cleveland Parish.
Thank you, Dr. McMahon. We appreciate that, and thank you for joining us on the line today. Appreciate the support we're getting at the state.
Thank you.
Yes, sir. Okay, we got somebody. Could you put up your phone on mute? Put phones on mute, please. Okay, any other questions or comments? Anything else off the telephone land?
Hey, Mike, it's Jason Parker. Can you hear me?
Yes, sir. Go ahead, Jason. How you doing, sir?
Hey, Mike, I just want doing well. I just great program, and I really appreciate y'all echoing Wayne McMahon for doing what y'all are doing every day, and the Springhill medical staff up there, outstanding job, and just kudos to everybody. And the sheriff's office is here for y'all. My sheriff, Jason, and I talked briefly about possibly, considering some kind of curfew for the whole parish, and we'll just play that by ear as the time comes. But that could certainly be something that we utilize. We got so many people out 2 or 3 o'clock in the morning just roaming around, and probably up to no good. So we're concerned about our citizens. We're concerned about the safety and the welfare of everybody. And I think Chief Lynn is on point with his statement that he made today, and keeping everybody at a safe distance. So I just want to thank y'all again, and just let you know I was on the line listening, and I appreciate everything y'all do. Y'all have a blessed day.
Thanks, Sheriff Parker. Appreciate you joining us today, and thank you. Appreciate you guys being part of the front line of defense always, but especially in these days. Thank you so much. Any other comments, questions?
A lot of thank yous.
Okay, I'd like to have just first of all, just thanking everybody on the line, our firefighters, our first responders, our defenders, folks on the line. We appreciate you, even the public service folks that are going out on a regular basis. Y'all please put your arms around all of our folks that are on the front line and continue to support. If you're on this line right now, it means you care. And I want to thank you personally for taking the time to be with us today, and also to take the time. I'll challenge you. I'll challenge you to take the time to maybe make an impact on somebody that's not listening, because we do see folks out there that are still driving around. I've got 2 kids. I've got an 18-year-old and a 22-year-old, and my 18-year-old's doing fine, doing homework, watching movies, talking with friends. My 22-year-old struggles. He's a little more like his daddy than his mama. He's a little less disciplined, and but he knows how to operate between the lines, and he's doing his best, and I think he's doing real well. But I struggle with it just with my home life and with our staff here, making sure that we're making the right decisions so that we're doing everything we can to minimize foot traffic, to maximize social distancing, to wash our hands, to cover our mouth when we're coughing or we're sneezing, all of those things. Please take the time today to impact somebody that you feel like is probably not abiding by those things. The other thing is I want you to know that the folks that you heard on the line today, and I can speak specifically for Tiffany, for Dr. Abshire, and for Clay, you probably have about 85 years of experience just in those 3. And then with the other folks that were on the line, you've got a lot of training, a lot of experience, and you've got a huge heart in these folks that are providing first-line care for you. I will tell you, we're going into this with a lot of planning. The last 3 weeks, we have planned and triple planned and looked at ourselves. Even this morning, we're even looking at processes this morning that we felt like, you know what, well, let's relook at that. Let's really see what we have capability for. Let's be realistic. How do we want to handle things? Shall we come up to, a larger number of patients? But I don't want to go there. I don't want to be at the point where we're putting our staff in front of a lot of patients. So help us prevent that. And I think we can just continue to social distance. If you feel sick, please call us. Get us on the phone. Give us a chance early on in the process to check you out. We don't mind if you call right now. if you're just wondering and you need help, that's what we're here for. The other thing is, the longer this goes and the longer people are out of work, I know this is very that are out. It's gonna board here at Springhill and has been dedicated to making sure that our staff stays employed for two reasons. One, because we know we're a large employer in the area and our families need it. And number two, we would not want to lose that capability right now to be able to take care of you if we do have a surge in our area. So I want to commend our board for the decisions that they're making, as well as commend the community for responding. If you're on this phone call right now, then that means you care, and I just want to commend you for that, and thank you. I'll tell you what, teamwork makes the dream work. I've heard that all my life, and it's the absolute truth. Every day I walk into our clinics and our medical facility here, you see everyone from the person that's cleaning the room, to the nurse that's at the bedside with the patient, to the doctor that's instructive, to our dining facility, to our back office business folks. They're coming up with innovative ways for us to bring care to you right now. And so I just want to say that it's an amazing amount of teamwork happening at all levels, and I appreciate that. A couple of other closing comments before I close. Our lab process that Dr. Abshire just explained, for those of you on the phone, you can't see it, but our lab director, I got to tell you, she's had to run through several different processes to get lab results, and that's just been one of these key things as we come into this, is getting quick lab results. Well, up until the recent past, we haven't had the ability to get the answers back to our providers as quick as we want to, but now we're there. We can get same day or within 24 hours lab results. So I feel like we're well prepared in that manner, and I thank our lab director, Brandy Litton, for championing that, but also for all of the folks along the cycle that have challenged us to get better. With regard to masks, if you're out there and you know of a way for us to get a large number of N95 masks, please help us with that. We have a limited supply, and we are in a reuse. We're re-looking at our reuse policy, and we're actually going to be instituting more guidance on that to our own staff tomorrow. But anybody that has additional N95 masks, that we would appreciate that, or have a venue for us to get it. I want to echo everybody's comments about whether or not this is serious. If you're on this call, you probably already know this, but there are still folks out there that have a difficult time putting their mind around this. The numbers today that are being reported by Dr. Fauci and the numbers that you're seeing across our country are staggering. We went into this week with about 2,000 deaths. We are past that point. We had 1,000 deaths on Wednesday, the largest number reported in one day in the United States. Our total number of COVID patients has now surpassed any other country. So if you don't think this is serious, or if you know someone that's not taking it as serious as they should, just show them the statistics that are being reported. It is. I'm a realist. I've said this from day one. I'm a realist. I'm not an alarmist. These are not conversations that we're making. None of us are making these conversations to make it sound like it's we're not the little boy crying wolf here. But I am a realist, and I want to be prepared. So we can all do our part and do our duty in that respect. Now, just to make it personal as I go into closing, again, thank you, Tiffany. You've done a great job of preparing us and facilitating this. We'll look forward to who you bring next week to have this conversation with. Clay, just really appreciate you being on the front lines, and also just getting to know you in this last year, and seeing how you've taken a decade of nursing experience and then applied that into becoming a nurse practitioner, and seeing what you've done in these last 2 years. Every time I speak with you, you are demonstrating to me how much you care about your family and care about your community as a family, and it's personal with you, and I really appreciate that approach you take. Dr. Abshire, I don't know if folks realize how much passion you put into everything you do, and the experience that you have and the guidance that you've given us here at Springhill Medical Center. As a family practitioner, none better. You guys are amazing. You got decades of experience, and I know how much you care about your community. So thank you for being on the line with us today.
Thank you for your generous words, Mike.
I'm glad you're still there to hear them. Thanks, Doc.
Yeah, thank you.
And share with the Tina Haynes today that that partnership between Springhill and Homer is solid. We're here for each other, and I'm glad that you're a bridge for that.
Absolutely, proud to be.
Yes, sir. And then lastly, I had a conversation with a doctor who is in New Orleans last night, and he shared with me he's doing hospitalist work, which means that he rounds on patients in the hospital in their med-surg floor. He's not in the ICU, but he is rounding on patients who are COVID-19 patients as well as non-COVID-19 patients. And, he was giving us some tips, and I brought it back into the team here today to talk about. But, a lot of the things that these guys are going through, he's a volunteer. He came from Shreveport, Bossier, and volunteered to go help down there. So, as we learn from each other, and this is my point, as we learn from each other, you may get that from a phone call, you may get that from a peer, you may get that from someone else in the community, but the key is to learn. We can all learn something every day. We're all leaders in learning. There's nothing that someone else doesn't bring up that isn't worth listening to. And so I send this note out to you guys as well to please, if you learn of things that we need to know about, share the knowledge. Lastly, like I said, this has become very personal. My best childhood friend is in New York right now with his wife and their son. He and his wife are sick. They're at about day 14, 15, actually probably about day 16, and it looks like they're going to lick this virus. But his wife lost her aunt yesterday to this virus, so it's very real for those folks in New York. And I'm just our heart goes out to those populated areas like New York and New Orleans. But like I say, it is not to be an alarmist. I'm just a realist. But we do wish everyone well. Thank you for dialing in this week. We'll have this up again next week, and we'll have a few more subjects for you, I'm sure, as well as new news. Hopefully it's good news. Maybe we'll flatten this curve and beat this thing. So be safe, guard yourselves and guard your family, and we'll look forward to talking to you soon. Thank you very much. Thanks, Derek, for hosting this for us.